Hi, welcome back to Prayer and Psychiatry. Today we're going to talk about schizophrenia. Now, schizophrenia, I can talk about it. I have extensive experience working in inpatient psychiatric hospital. So most patients that I saw were actually schizophrenic patients. Now, their intensity varied. Some of them were actually having very severe episode of schizophrenia. Now, others were having a little less intense symptoms of schizophrenia. Nonetheless, schizophrenia is a mental condition that is not something that you should take lightly. It's a mental health disorder that requires attention, and it can affect your life in a very negative, severe ways. So schizophrenia is a condition of the mind. It's could be genetic. It could also happen due to some stressors. Some of the symptoms of schizophrenia are hallucinations and delusions. Hallucinations includes people seeing things, hearing sounds that you and I may not hear or see. Now, delusions are false beliefs. Those false beliefs are so firm in their mind that no matter what evidence you present to them, they will still say that the false beliefs are true. Also, another prominent symptom of schizophrenia is schizophrenic patients do not recognize their disease process and they are unwilling to take treatment. Their negative symptoms of schizophrenia include patients not taking care of themselves. They become secluded. They do not want to take care of their hygiene. They become isolated, and as well as they go into depression as well. Some of the treatment options for schizophrenia are antipsychotics. We can use first generation antipsychotics, which nowadays are not used as much. The good options are second generation antipsychotics. Some of them include olanzapine, which is Zyprexa, Risperdal, as well as quetiapine, which is Seroquel, and Abilify as well. Depending on the severity of your symptoms, the treatment will be prescribed, as well as therapy is also a recommended option. It's always a combination. We utilize medications along with therapy. Schizophrenia is indeed a very severe mental health disorder that can affect your life in a very negative way. However, the treatment is available. At present psychiatry, we have seen many patients with schizophrenia that are doing very well because we formulated the right treatment plan. We recognize their symptoms. When we only did not treat their symptoms, we got to the core problem. We figured out what the patient is suffering from, and we got to that problem. And that's what we do at present psychiatry. We don't treat the symptoms. We treat you as a patient, as a person, and we get to the problem. Thank you for listening.